My name is Ryan Ashlock, and I'm the Chief Operating Officer at Adventist Health Castle in Kailua, Hawaii. Previously was the Chief Financial Officer for Adventist Health Feather River and led the evacuation and then post-fire recovery efforts after the campfire in November of 2018. On the day of November 8, I was the administrator on call and was the only executive that was on campus that morning, and arrived to the campus around 7 o'clock that day to find that there was a fire that was just starting about 7.5 miles away from the campus of our hospital. And over the next couple of hours, we went from having a rather calm situation of being told a fire is not a threat to our hospital to within a matter of minutes, we were in a situation where we had to evacuate the hospital. So within 35 minutes, we went from the fire is not a threat to the fire is a threat, and 45 minutes later, we had the hospital completely evacuated, and I led that evacuation effort on that particular day. Surprisingly, was fairly calm. I think that's one of the attributes that is a strength of mine is staying calm in difficult situations. And I knew I had a great team around me. The team members are one of the most important pieces of a situation like that, by having a reliable team around you that has done the necessary training and preparation around emergency management and knows how to react when a situation such as this one came upon us. And we were able to successfully implement our disaster plan and evacuate all of our patients and our staff in a quick and calm manner, and everybody's safe today because of it. It's important to not get too focused on what you typically would have in a training environment. You do your fire drills, you do your evacuations, but somehow you've got to prepare for the unexpected. You're not going to be able to prepare for every aspect of it, but we never prepared for the fact that we had to evacuate patients into personal vehicles. We also never prepared for the fact that we needed to evacuate a hospital in 45 minutes. Typically, you would prepare for that over a matter of hours. So you really got to think about what are some of the things that could happen that are outside of the norm that pushes you to do something differently. So I think as organizations do their disaster training and drills, that it would be good to identify some very unique situations that would push them to go outside of the norm of what your disaster process may be or what your policies may say. One of the things that was amazing about the evacuation process that day was the amazing work that our team did. And there's a couple of examples that I could call out. One is the fact that the marking of the doors when we evacuated. We had a couple people that focused in on that, and we were actually commended by the firefighters who came in several hours later that they didn't have to do as much sweeping through the facility as a result of the outstanding work that our staff did on marking the doors and showing the areas that had already been evacuated. Another component of the evacuation was just the willingness of staff to literally put their lives on the line to be able to help our patients. We had identified that in our disaster plan that there would be one specific area of the hospital that we would evacuate. However, because of the fact of where the fire was coming from and the embers that were falling, that no longer became an option for us. So we had to get creative on the fly, and people's quick thinking and thinking outside of the box allowed us to create a new evacuation area to be able to get to what was now identified as our secondary evacuation point. The third thing that I would focus in on is the fact that we asked our staff to be able to evacuate our patients in their personal vehicles when ambulances did not show up. And those staff didn't know that they were about to drive through flames and what many have described as literal hell, driving out of paradise that day, but yet they were still willing to do it. And they put in patients that were in critical condition and didn't even necessarily have a clinical background to know how to deal with them, but yet they didn't care. Patient safety came first, and they successfully navigated a very difficult situation and got them to safety at the other area local hospital in Chico.
You guys face any repercussions legally from doing that?
We did not, no. It's what we needed to do given the situation that we had, and we're very proud to say that none of our patients were significantly injured or died as a result of the evacuation from the fire that day.
What advice would you give your previous self now, looking back, or you wish someone had told you?
What I would say is trust the decisions that you make. I think it's easy to second guess things, and in the process afterwards there was a lot of second guessing of should we have evacuated, should we have done this, should we have done that, but your first gut instinct is always the right one, especially in a disaster type of situation. And so what I would have told myself then is don't worry about what the repercussions of your decisions are in a situation like that, that your gut instinct is the right one, and go with that.
What are some other resources or things you've turned to as a healthcare executive to help prepare your new hospital for this?
Several different things. I mean, one is grief counseling, and making sure that that is available real time in a situation that a disaster happens. You have individuals that are significantly impacted. Typically, you think about caregivers, they're so used to giving that they need someone to actually give back to them, and they need to have an opportunity for an outlet, an individual to talk to and just talk through their feelings. I think as you look at other things that I've looked at with our organization is going back to the drilling again and making sure that it's very much a real life situation, and making sure that the staff understand that, because it's easy for you to think that, okay, we've got to annually go through and do these types of drills, but you can't just go through the process. You really have to understand that a situation will occur at some point, whether it's an active shooter situation, fire, hurricane, flooding, whatever it may be. You have to be really ready to react to that. And the more that you have a real life situation that you're preparing for and reacting to in your drilling, the more that you're better prepared to that when it actually happens. The other component that I would stress for organizations that we're implementing at the new organization that I'm at today is you need to have multiple people trained in emergency management. You can't just rely upon the couple individuals that do that on a daily basis, because as a disaster strikes, they may not be available. So if they're not available, you've got to be able to have some backups, whether that's in relationships with community organizations, or from an incident command perspective, you have to have 3 and 4 people deep that are trained in each of these areas so that they can be able to step up the 3rd or 4th man down if the first couple of people aren't available. My name is Ryan Ashlock, and I led the evacuation and recovery for Adventist Heather River, part of Adventist Health, as part of the campfire in November of 2018. And should you have any questions or would like to be able to discuss our learnings and our process from that event, feel free to contact me.